Well, hello, hello, and Happy New Year, wonderful technologists. I know I have been away for a bit, just ramping up and getting together all the episodes for 2024. Yes, so far it's been a good start to the year. Had some bumps, 22 days into the year, and here we are. So I hope you guys had a wonderful new year. I've definitely missed doing podcast episodes because this is something that I love to do. And just been kind of gearing up, trying to get new episodes, trying to get some guests to come on. So, I'm going to be reaching out to some of you on my Instagram so we can collaborate on the show and possibly be a guest on like other podcasts. So I'm excited to do a lot of good things. A lot of good things are happening for the CT educator for this year. So got some courses. So I know I've released the cardiac course. So far that has been something that is really good. I am going to do a couple more courses, do a YouTube channel. So I'm pretty excited about all that. And plus I have a new course platform that I am going to be moving to. It's a little bit more robust and you'll be able to find everything along with the podcast episodes and the video podcast episodes on this new platform. So stay tuned for all of that. That should be coming out here shortly, probably within a week or two. So, in today's episode, let's dive in. I wanted to talk about, let's be real on the challenges in CT. Okay. And I know I've talked about previous episodes when it comes to regarding how challenging it can be with new technologists coming into the field, maybe a technologist that has a year or two experience, that it can be a really overwhelming time for them. It can be something that is very daunting because CT is a very complex modality. And also, it is just very complex. And we know it's complex, right? So, I want to be real what the challenges are. I know myself as a new technologist, I encountered a lot of challenges. So what I mean by challenges is that I came in and had no freaking clue on what I was looking at because I had never looked at a CT image ever before in my entire career. Coming from X-ray and then going to another modality that is more complex, more robust, more just everything. And it's used mainly to clinically diagnose diseases and other things. It could be a really fucking scary time. So it's pretty scary when you're out there. So I think we have to acknowledge the challenges and we have to face them head on so we can help these new technologists coming into the field so we can make them like really good techs, you know? Because you and I both know that we have encountered some pretty, I'm going to say this, pretty shitty techs. Okay. I am no holds barred on this podcast and I say what I mean. And it's just the God honest truth that we have encountered some technologists that are just not good. Okay. And that just refuse to learn. They refuse to enhance their skills, enhance their education. And they just have this really just piss poor attitude about, oh, well, this is how it's done and that's it. Right. So I think what we need to express as the challenges is that there's really not enough of education that goes out there. There's really not enough of courses. Now, don't get me wrong. There are CT programs that do exist out there, whether they're online, whether they exist in a university, a college, whatever it is, right? So, but there has to be something where when they're training out on that floor that they can refer back to as far as education within the clinical site, within the working area, within just the hospital itself. And I know I talked about this on a previous episode that hospital-based programs should really come back. I'm not quite sure why they did away with it. Maybe it's because of, not enough staff running it or just no interest. I'm not quite sure. But I think that if we brought back those hospital based programs, I think it would help some of those technologists out there that are really, really struggling. And I know there's some seasoned technologists that do struggle too. It's all a learning process where we don't gatekeep knowledge, we share information, we collaborate with each other, and we just help each other. That's what it's all about. Starting as a new technologist, you encounter how to look at an image, how to set up a protocol, how to set up your room, contrast media, what amount to inject, how fast are you going to inject, what type of IV do you need, what are the policies and procedures, when a patient's allergic to contrast, what are you supposed to do? When you have a pregnant patient, a dialysis patient, or patients that are renally compromised or diabetic patients. These are all the things that I think we're missing the mark on as far as making sure that when they come into the modality, they really need to have just the core, just basics, like the meat and potatoes, okay, of how to execute a scan properly and make sure that they execute that good image quality. Those are some of the things that are very challenging because as a new beginner, you're coming in and you have no freaking clue what you're looking at on a screen. You may not, but I can tell you 90% of the techs that I've trained over the 20 plus years that I've been a technologist have no clue what they're looking at on a screen. That's where we need to take the opportunity to go ahead and educate them, help them, make sure that we can collaborate with other people to really give them the knowledge, give them that core basics, give them, that help that they desire so they can excel and just get better and better and better as time goes on and they gain more experience, right? Because that's what it's all about. I think what's also challenging is that we don't have reading rooms anymore. So it's not like you can go in and talk to the radiologists. A lot of the radiologists now are only like at the facilities for a short amount of time or they're working remotely because that's where it's shifted in, I would say, probably the last 5-10 years. I mean, radiologists were remotely even before COVID, but now that's more of like the golden standard as far as what I see. So it's not like you can ask them a question. And I could tell you another challenge is when you call that reading room and those radiologists are so busy that they cannot answer your question and you really have seen something that is pressing, that can be really challenging. And some of them, I'm going to tell you, some of them freaking cop an attitude. Because I could tell there's some radiologists at my facility that cop an attitude when you call them more than once. I'm going to honestly say if a radiologist ever listens to this podcast, we as technologists, the reason we're calling you is because there's a legitimate question and there's something that is pressing to expedite the diagnosis or the treatment of the patient. So we always kindly ask, don't shoot the messenger. We're trying to answer either the doctor's question because they can't get a hold of you, that, you're unreachable. We're trying to say, hey, there's something that's suspicious on this CT. Can you take a look at it to see so you can call them and let them know what's going on with the patient? The last thing we need is to have attitude and have animosity between technologists and radiologists. That is a collaborative partnership. Like we work together. And I know there's some radiologists out there that think we work for them. No, we work with you, not for you. Because at the end of the day, we work at the same facility, right? So that seems to be a challenge because when there's something pressing with the patient and we're trying to figure out, okay, is this positive? Is this negative? Because you're having a suspicion and you're questioning. It always helps to call the radiologist. But I know a lot of technologists don't like to do that because of the interaction that they get with the radiologist and just the attitude. Listen, we're all overworked. It's not just the radiologist. We're all short. It's everywhere in healthcare. Okay. We just need to be a little bit kinder to each other and collaborate more on how we're going to execute the treatment of the patient. Because at the end of the day, that's what it's all about, right? So I know those are a few challenges that I have seen in CT, minus, the short staff, the constantly working of overtime or the cut of overtime. Those are some of the other challenges because we're getting such a high demand of patient load, and we just don't have enough staff to provide to execute the amount of work that we have, which presents a real challenge in CT because sometimes, they hand out referral bonuses and things like that. And oh, here's a sign on bonus. But technologists are looking at they have lots of choices. They're looking at other opportunities. They're looking at all this other stuff. And you have to make it worth their while to make them want to come there. So, I think those are some of the challenges too, because I could tell you at my facility, we have a lot of open positions. There's quite a few. And it's hard to fill those positions because we all know our radiology community is very small and we all speak to each other. So we can say, oh, maybe I might want to work there. Maybe I don't. And I know there's a lot of travel opportunities and some technologists are doing that. Or they're getting out of the patient care aspect and doing other things. So those are my thoughts as far as some of the challenges that are presented in CT that we face every day that we see. Let me know if you have any challenges. I would love to hear that. You can always email me. Email will be in the show notes. I always like to hear stories, comments, feedback, anything. I love it. Or head on over to Instagram and send me a DM. So it's at the CT Educators. So everything will be on the show notes on all the links and everything that I talk about on this episode. So yeah, let's have a chat. And if you're interested in any CT courses, make sure you check out my site that has all the courses. I have an awesome cardiac course. It's a one-on-one, just kind of, basic stuff. I have a basics CT course, and I have an ebook and some PDFs that will really help you in your CT journey. So that is it for this episode. Hope this was really insightful for you. So come follow me on Instagram, send me an email, and let's talk about all the CT things. So hope you have a great week, and I will talk to you next week.